Okay, there we go. So this is the Board of Health meeting of February 5th, 2025. Everyone on the board is present, and we also have as our guest Megan Tudrin from the collaborative. And Meg, we don't want to take a lot of your time, so I want to just jump right to you over any other thing that we have to do, and you can tell us what we need to know about SAFE 2.0.
Sure. So SAFE 2.0 was passed. It was, we were trying to pass it for about 10 years or so. The FERCog worked really, really hard on getting this passed. So it's to plan for public health spending for everyone to be equal. So this is like Governor Healy is going to start putting this in her budget. So Shutesbury might not be able to afford a health inspector at $50,000 a year, but we expect you to do the same amount of services. You still have to do housing and things like that. So this is part of this survey that we're doing is so that the governor knows what we're lacking, that, you know, Shutesbury doesn't have their own inspector, and you don't have your own public health nurse. We have it because of the grant, but that's going away. So when that goes away, how are you going to be able to provide the same services as those in Boston? Because your residents deserve the same services that they get out east. So the governor is going to now fund with, when she comes up with her yearly budget, she has to include spending for local public health. That's what SAFE 2.0 is. Along with that, some things are required. So the inspectors have to have certain training, like fit training within the first 2 years of hire, or fit is food and housing training. They have to have their lead determinator with a certain amount within a certain amount of years. They have to get their RS within 6 years of hire. So there are a set of standards. Nurses are supposed to have their bachelor's degree. Some things they will allow waivers for, which we're really pushing, because it's also not, we also push equity, and it's not equitable to say that somebody who's going to get paid, you know, $50,000 a year or so has to have a master's degree. And you know, it's just, especially around here, you know, we don't have all the opportunities for big colleges and all the scholarships and things like that they might have in other places. Transportation is always an issue here. You know, you can't do online classes in some of these smaller towns because of the internet access. So we really push for those waivers to be accepted. So in order for the governor to figure out what we need, she's got to do this survey. The survey is called Foundation of Public Health Services. It's an extensive survey where they ask what your town is providing. They ask what your town's providing. They ask who your partners are, and not just the collaborative. The collaborative does their own and will just automatically answer yes to yours. Like whatever I fill out in the collaborative is automatically going to go over to yours, like public health nursing services and things. So for a lot of Shutesbury's, I'm going to be answering no, because you don't have your own public health nurse and things like that. But when I go into the collaborative part, I'm going to say, but they do have, or into the partners, I'm going to say, like LifePath is available to us. We have Moms Do Care that will service Shutesbury and Leverett and places like that. There's lots of the Council on Aging, and you know, all sorts of different partners that we can drum up support for. And so those all go in there. So we're not going to answer that we don't provide any services, because you do with all of the other partners around. But it might look more like 25% or 50%, things like that. In Greenfield, I only have maybe 400% in Greenfield that we have coverage for our whole community. One of them is MAVEN coverage and communicable diseases, but almost everything else in Greenfield, I only have 70%, 75%. I did do Deerfields, and they're ranging around 50% for most of their answers. So I think that I know that we're definitely lacking in services here because we just don't have it. So if you wanted to do your own survey, there's a woman named Kyla who will do a Zoom meeting with you. And it's a training. It takes about 2 hours to figure out how to do the survey. Once you do the survey, it's been taking me about 8 hours just to fill in all those blanks that I was just telling you about. There are questions like, you know, how do you provide communicable disease coverage? Do you, um, how are you with equity? Do you provide inspectional services? Some of them are much harder to answer. They're, you know, they might be 4 or 5 sentences long. Um, it's really, I can't even describe how extensive it is. That really it takes about 8 hours, and that's just for the part where it's saying what do you provide. I haven't even gotten into the cost section. In the cost section, maybe Shutesbury might be easier because really you only have, I believe you only have the inspector that you're paying for. Is that right? Do you have any other
Um,
out of pocket expenses?
Well, right, we have the health agent services that we pay for.
Mm-hmm.
And I guess our regular budget line really only covers, office type things. So we don't provide any
Yeah.
services with that.
Mosquito
Um,
control.
I'm sorry, Garrett?
Mosquito control. We pay into the mosquito control district.
All right.
Oh, okay.
Right, we have that. Right.
Okay.
Yeah, we may have a little bit more than you think, but not very much.
Okay, so that section is going to be, I think, easier for me to fill out in Shutesbury because it, you know, I think that we just have maybe those 2 line items. I don't know. Do you guys have purple air sensors, Garrett?
Air sensors?
Not
Yeah.
that I know of.
Okay, that's another thing that a lot of the towns have to monitor for environmental health. So yeah, that part might be a little bit easier, but again, that's another training. The cost tool is a separate training with Kyla. So I'm happy to help out with this if you want me to, but if you guys feel like you can do this and have the time, absolutely, I'll hand it over.
I would love it if you could help us with this. If you already know how to do it so that we can skip the training part and go straight to providing the answers, then that would be enormously helpful for us.
And I did tell Noreen too that if somebody wants, before I hit the submit button, if somebody wants to come over to my office and just look on my laptop with me and just kind of review the answers, I'm more than happy to show you what I put too. Because that would be easy for you just to like look over and things. I can't print it. It's not a screen that I can print out. It's like lots of drop downs and things like that. But if you guys want to see it, that's totally fine.
Yeah, I think we should. I mean, that's the least we can do, right? Is at least come over and make sure that we've given you the right information.
Yeah.
So how should we proceed?
You don't have to do anything else right now. I'm just finishing up Sunderland's. I'll probably finish that one this week. Next week, I'll start Shutesbury's. And then as soon as I'm done, I'll send you guys a message, and whoever wants to come over, we can set a meet date in the office and just show you what it looks like.
Okay, and you don't need any preliminary information from us?
The cost tool, if there's one person who knows how much you pay into the
yeah, I know that.
district and
we just did the budget for that, so I don't have it at the top
Perfect.
of my mind, but I know, but I have it.
If you could send me those 2 numbers, that would be fantastic.
Two numbers? What was the first one?
The mosquito and the Eastern
right.
Franklin County. And then if you could tell me about how many, like, do you pay for a certain amount of hours of service for the control, the Franklin County, the Eastern Franklin County thing? Like, do you get, like, say, Claudia for 10 hours a week, or is there an expected service?
Yes, there is. I think it's more than 10 hours. All that is on the budget sheet, and I'll just send that to you.
Great. And then I think that's all I'll need from you guys.
Okay. Well, that's fantastic. Words cannot express my gratitude to
No
you
problem.
for helping with this, or for
No
basically
problem.
taking responsibility for it. That's just great. So I will send you the numbers and for the mosquito control district, and I'll send you the whole budget sheet that we did in the meeting the other day of the district. And
Okay.
seems like that should be enough. for now.
Yeah, sounds good. And I'll reach out if I have any other questions.
All right. Well, that's excellent. Thank you so much.
No worries. Thank you all.
And I'll send you an email about the other issue.
Yes,
Okay.
sounds perfect.
Thank
Can I
you.
ask one more question, Megan? And
Absolutely.
maybe we need to bring it up at the collaborative and here too. Is there any information? I think we got something from the state this week on bird flu, but should we be paying attention to that? Do you have any quick things to say about that?
So in my opinion is we go through this every single year. Every year the variants change. Every year they tell us, you know, we're one step away and it could get into humans and be a pandemic. At this point, I wouldn't be too concerned with it. Just because I've been here for 5 years, and at least 4 of those years I've heard the same things. So I wouldn't be too nervous. Yes, we have it in the wild birds, but it's just like the human flu. It comes every year. It can always mutate, and then my answer would totally change if it mutates. But as of right now, it's fine. We don't have it in any of our dairy cattle in Massachusetts, which is fantastic. Some other places do, but in Massachusetts, we also practice better practices. We're not throwing our animals on top of each other. Same with our poultry. We don't, we just don't put our animals on top of each other. So we're not as at risk as some of the other, factory farm type states.
Mhm.
So, as far as it going to humans, I think the risk is very low right now.
Okay,
Good.
great. Thank you.
Anything else we want to ask Meg before she signs off?
We're glad you're there, Megan.
Yes, we are.
Very much so. Thank you so
Oh,
much.
I'm happy to help. Take care.
All
You
right.
too.
Bye, Meg. Thank you.
Okay, well, that sounds a little bit less worse than
Less
Yeah.
worse.
yeah, than it was sounding when I first heard about this. If they sent us a message saying that this was coming, I didn't get it. So this came as a complete surprise to me, this whole survey thing. And I was appalled to hear that they designed a survey that you actually have to take a training to fill out. I mean, who thinks these things up? No?
Really.
But as usual, they didn't ask my opinion. Right? It always happens that way. So while I've got you here, last meeting was January 15, and the last meeting before that was in December, and that would have been the 18th, I think. And we have not approved those minutes. So
Oh, okay.
can we approve them?
I move that we do so.
Do I hear a second?
Here at second.
Okay. Are there any objections to approving the minutes as written and distributed? Hearing none, I'm going to consider the minutes approved for those 2 meetings. So Noreen and Garrett, you weren't here last time. So you didn't hear, or you maybe were not so much aware that we now have our own Zoom account. So, and no, we don't have to share it with anyone. So, and there are numerous new accounts. So, but some people share, but we get our very own, which means a couple things. One, Garrett, I'll have to kind of get with you and get you in the picture so that if I can't do it, you can back me up. And 2, it means that basically we could have our meeting anytime we want, as long as we meet the posting requirements, right? So that if we need an extra meeting, or if we have some reason to want to change it, we have the ability to do that, because we won't be, disaccommodating somebody else.
You mean we can meet 5 nights a week?
We could, and I think we should. We practically did during COVID, if you recall.
Yes.
That would get people talking.
Yeah, really.
This is the Board of Health meeting every night this week.
Boy, they must be really busy.
Yeah,
Um, um, as you see, Wim is invisible but here, and I had totally forgotten that he had surgery 2 days ago, and he told me earlier that he, on a scale of 1 to 10, his pain is 10.
Ooh.
oh,
So we appreciate your being here, Wim.
well, Wim,
Sure
Sorry.
do.
and, hi, Wim, and that's a knee, right? That's his knee?
I think so.
I forget the surgery.
I think it's his knee.
I
Anyway,
think it was me, yeah.
That's my knee. Yeah.
do you need anything, Wim?
No, I've got everything I need.
Okay.
Thank you. But it's
All
it's just, well, you know.
So, but my experience was that
Mm.
day 2 post-op was the worst,
Yeah.
and it got better from there. So hang in there.
All right.
Okay.
What day are you, Wim?
2.
2, okay, well, it makes total sense.
Yikes.
Yeah, it's pretty
Well,
bad.
Yeah,
I'm sorry to hear it, but if you need anything, please reach out.
All right.
We're all available to some extent. How
Exactly.
is Polly doing with the arm thing?
She's well along with her recovery.
Mhm.
She can't really use that arm a whole lot, but yeah, we're sort of a rehab hospital.
But, well, you sound intelligible.
Mm.
Perhaps a little bit drugged, but listen, if Polly is not supposed to drive, I'm sure we can manage among us to get you to your PT appointments.
Yeah, you're very nice. We arranged all of that beforehand.
Oh, very good.
Yeah, and I have the first 2 to 3 weeks it's in home.
In home, right?
Oh, excellent.
yep,
Yep, that was true for me too, and I'm sure for Noreen.
yes,
Mhm.
that's great. That's
Yeah.
genius to
Yeah.
have somebody dropping by, yeah.
Yeah.
Except they hurt you.
Yeah, they do,
Well,
but
yeah.
not too much.
Yeah,
I'll send you an email, Wim, about some other stuff, like things I can lend you if you need it, that kind of thing.
All right.
yes,
Thanks.
and I think our advice is gonna be do your PT and you'll be back doing what you want to do.
You will
all the
be up
sooner.
and at 'em anytime soon. Yeah,
Yeah.
in no time. Yeah,
Very good.
okay.
That's great. I have a couple of things to tell you. I did get a cryptic communication from the owner of 56 Wendell Road about, he said that basically it's lawyers now, that lawyers are involved in getting the demolition permit and so on. I didn't ask for the details this time. I just, clearly something is happening. It took a while for me to be able to actually even make contact. But I'll look into it, between now and the next meeting and see
Okay.
what more we can find out. Also, we got an email today from the Belchertown Board of Health, from one member of it, who wants us to adopt, our board, to adopt a resolution supporting, let me look and see exactly what, supporting some kind of tobacco-free initiative. And Gmail. It's kind of weird, of course, because we don't have any place where we sell it, but they amended their tobacco regulation in Belchertown, and they included something called nicotine-free generation, changing the age for nicotine sales to those born before before 2004. So I guess that's raising the age, and they wrote a resolution for us. It says, the Shutesbury Board of Health resolves that other Massachusetts communities and the legislature are encouraged to enact nicotine-free generation regulations, creating a generation that is free from nicotine and helping children and young people avoid nicotine products, and that the Board of Health would itself consider a nicotine-free generation regulation if the town of Shutesbury has any licensed retailers. I would change that to if the town of Shutesbury had any licensed retailers, since we don't. And I don't know if you guys would like to adopt such a regulation or what? Or if you want to think about it and talk about it next time.
Well,
Regulation
if
or
it's,
resolution?
sorry, go
Sorry.
ahead. Go ahead, Noreen, sorry.
Is it a regulation or a resolution? I thought
It's a
you had said-
resolution. It's a
Yeah, thank you.
non-binding
Yeah.
resolution.
Right.
So basically, it's simply offering our support for this, this initiative.
I was just gonna say, if such a resolution supports our surrounding communities, then I'm all for it. Although I don't see that it impacts our community directly, but, you know, people don't, people interact with our surrounding communities all the time, so.
Right, and our children go to the schools down there
Exactly.
too.
That,
So,
that's what I mean, yep. Mm-hmm.
Fine with me.
so what would you like me to do?
Is there language for the resolution?
I just
Language
read, I
provided?
just read it to you.
Oh, excuse me, I understand. I would support adopting such a resolution.
Any other thoughts on this?
I think the only question I have is, would we need to advertise? Would it have to be posted as part of the agenda that we were considering this?
I think it would be good if we put it on the agenda posted, and so that it would be out there.
Yeah.
Okay, so what was a nicotine-free generation? I will put that on the agenda for our next meeting,
Okay,
which will be like the 19th of February.
right, because we need to advertise it before we adopt it.
Right, I think we should.
Agree.
All right. Garrett, do you want to say anything about, well, two things about the drill today, which thank you for taking that. I was trying to find my way around Big Y, which is being totally reorganized when I got that, when I got the message, and I knew that I had very little chance of making it on time.
Well, I knew I was sitting in front of
go
my laptop and had the window for WebEOC open anyway, so I thought I'll just do it. So I logged in pretty quickly and discovered that what the message was asking you to do, you couldn't do because they hadn't set it up right.
Right.
The drill for them, and they failed.
The email that I sent you later today, scratch that, because I went back and I saw my previous notes about how you are supposed to enter that incident. And anyway, scratch what I sent to you earlier, but
So I quickly messaged person at DPH who organizes the drills and said,
Oops.
it's not there, what you're asking to do, just so that you know. And I don't know, maybe about 4 or 5 minutes later, I got a message back saying, oh, it should be there now. So I was able to do it the way that they wanted us to do.
Terrific.
So we're all set for that for the quarter at least.
Excellent.
thank you for doing that.
Thanks, Garrett.
Yeah, thank you.
And you did some other kind of framework survey or something? Would you want to tell about that?
Yeah, so for the public health emergency preparedness grant, one of the deliverables there are 2 deliverables that relate to this.
Mhm.
One of the deliverables is that the coalitions, the public health coalitions statewide, have to develop or update a public health emergency preparedness and response framework that gets integrated into emergency plans.
Mhm.
There with zero guidance. There's zero guidance or guidelines about what that means. Neither from CDC or DPH. And then the second deliverable is to do a needs assessment, also with no guidelines or guidance about
Our
is-
need is for guidance.
right. What is meant by needs assessment. In Region 1, Western Mass, they've interpreted that to mean training needs assessment. And other coalitions statewide have interpreted it differently.
Mhm.
So at the Region 1 level, so the HMCC has organized all of the public health coalitions, and they developed a survey, another survey, around what's the best way to describe this? Aspects or components that might make up a framework. So that could be infectious disease investigation in the case of Maven. It could be inspectional services around housing or food and restaurants. And so the survey, it's very repetitive, unfortunately, and it's being done across all of the coalitions. So all of the coalitions in Region 1, whether it's Hampshire, Hamden, Franklin. And it basically asks, do you have a plan that addresses this element of a framework? If so, is there someone specifically within your Board of Health or community who has an assigned preparedness and response role related to that? And then it asks for contact information for that person. So I went through the survey, and in many cases, because we don't necessarily do that, or there isn't a plan for us to do that, like a good example is around isolation and quarantine. We don't specifically have a plan for that,
Mhm.
aside from what regulation says that we can do. So in many cases I had to say, no, there is no plan. And in like limited cases, I could point to Claudia as having assigned roles and responsibilities related to certain things.
Mhm.
As it related to coordination with emergency management, I pointed to me because I go to the EMT meetings. There were some administrative questions that I pointed to you, Kat, as having roles and responsibilities on the board related to it.
Mhm.
I think it's more of it's somewhat like the survey we were talking about earlier, that Megan's completing
Mhm.
for us. It's more fact finding than
I
anything.
see. Mhm.
And I think basically they're going to use it to try to inform, is there an existing response framework across Franklin County? And are there people who have assigned roles and responsibilities related to it?
Okay. Okay. I often feel that the whole idea of all this planning kind of misses the mark. Like planning for isolation and quarantine. What's the plan? I guess you just have to plan to have somebody who's going to do it if it has to be done. That's really the extent of planning you can do, I think.
Yeah, and then I think like in that example, there's planning around barriers that individuals might face who have to go under isolation or quarantine, and like accessing prescription medications or, food or other
Mhm.
services. My gripe with the whole thing is that if there's not, sort of state level organization and guidelines and criteria that they're, not that they're trying to force on us, but, trying to have some standardization.
Yeah.
Or even to just define what it is that they mean.
Yeah, right. Yeah, well, as always, they don't get Western Massachusetts. And they really never they don't even make an attempt to meet the needs of all these small towns out here, where it's all volunteers, and it's basically community oriented and community based, and if people need anything, ad hoc little support groups spring up. It's not like we have a hierarchy.
Right.
But that doesn't look that great on paper. That's the thing.
Yeah.
Well, thank you. Thank you for working on that. Is there anything else that we would need to talk about? Is there anything I'm supposed to be telling you? Just by way of general information, yesterday I heard from the chief of police that she's hoping to put in all kinds of recreational space behind the fire station. There used to be apparently quite a lot of stuff back there, a softball diamond and a equestrian ring and some, horseshoes and other stuff. And she wants to bring some of that stuff back.
Huh.
So
Okay.
that'll be a nice thing.
I'd
We
like to
should
bring
bring
back.
Go ahead.
I'd like
Oh.
to bring back my ability to play softball again.
Well, we can work on that.
Is Kristen working with the recreation committee on that?
She's planning to. It's very
Okay.
early days yet, but I think
Okay.
she was waiting for a call back from them, and she's gonna, this is a great way to spend some CPC money.
Sure. Okay.
But she likes to get all her ducks in a row before she starts
Yeah.
talking about it. But it's not a secret either.
Okay.
Let me just look for a minute at the Board of Health email and make sure there isn't anything that we're supposed to talk about. We did get a message from somebody, from the Commissioner of Public Health about staying the course and the problems with the current administration. And
Oh, yeah, I see that.
yeah, I'll send that to you if you don't have it.
I do have it, but go ahead. I mean, just send it to all of us if you need.
Yeah, I don't know if everybody has it or what, but it won't
I
hurt.
haven't,
Won't hurt to see
this
twice.
is the first time seeing it. I haven't read it. Yeah.
Mhm. Yeah, I haven't actually read it all the way through either.
Okay.
But yeah, we're just gonna have to try to hold the line somehow.
Did I hear earlier in this meeting that the grant, is it the grant that funds our health collaborative is expiring soon? Did I hear that correctly?
I think it's got like a 10-year life. Is that right, Garrett? Do you know?
Maybe even less than that.
Huh.
I think it
Do you
might be
remember, Brian?
5.
Yeah.
And that's why they're trying to set up a long-term funding stream.
Mhm. Mhm.
Okay. So it's not imminent, but
No.
we should be
No.
forward thinking about it. Okay.
Right. Yeah, I thought it had a longer life. How long has it been running? Just like a year, 2 years?
But I'm gonna say 2.5, maybe.
Uh-huh, well,
Oh, well,
Right.
it's been running longer in other parts of the state. It's just that we've just joined the collaborative process
I see.
later. This whole area, Western Mass was later to join it. So,
I see.
so maybe it might have been 10 years in other areas of the state.
Uh, uh-huh. That reminds me, they have raised the fee, the annual fee for the mosquito control district a little bit. They put I think 10%. So it's not huge, but there you go.
And I saw something in the Board of Health email about how they're looking for a new person to head that up. It looks like there's some staffing changes going on in there, but
The mosquito control district?
I might be misspeaking. I would,
Yeah, there is something about a health director. Oh no, health director input sought for tick and mosquito research. Is that what the thing that you're
oh, maybe that's what
Yeah.
I'm thinking of.
from WMPHA?
Yeah,
Uh,
because the director of the mosquito district was just new last year, wasn't he, Kat? I think.
Yeah, just I think the year before.
Okay, so 2 years, but yeah,
Yeah,
he seems to be quite good.
he is good. And although strangely, he got the idea that I had retired, and he sent an email to Sarah asking to meet with her, and she sent it on to me saying, I don't know what to think about this. Is this guy trying to sell me something or what? And I said, no, it's good. But then I sent him a thing and said, I'm still here.
sorry, I am trying to find the thing that I'm referring to and I'm not finding it. So I don't know what I'm talking about. Sorry.
It happens. All right.
Yeah, where is that? Anyway,
But
okay.
anyway, John's still firmly in place there.
Okay. If I come up with another question, I will relay it on, but
Okay.
okay.
All right. Is there anything else that needs to come before us at this meeting? Sounds like a no.
For me.
All right. Well, let us adjourn and see you again in 2 weeks. By that time, I probably will have had my nomination papers thoroughly signed and turned in.
Oh, good.
Oh, so you're the one rolling off.
I am, and let me tell you, before last November, I kind of thought maybe I'll start cycling off, like maybe I won't run, but I'll stay on as a clerk or something like that. But it seems it would be cowardly and craven to bug out now when there's opposition.
We all put on our puppy eyes and looked at her and she.
No, I had already decided, right?
Okay.
I'm not gonna, right. However, 3 years from now, probably not. I mean, come on. So let's be thinking about trying to bring somebody else on.
Okay.
There are some good people in town that might be interested, but
If you have suggestions, please pass them along.
I will.
Okay.
I will, and you too.
Yeah.
Okay, are we done?
All right, well,
Yeah.
Wim should be feeling quite a bit better in another 2 weeks, Wim.
Wim, you're going to be feeling great very soon. Hang in there.
Yeah, good luck, Wim. I'm sure you'll feel better soon.
He's asleep.
Yeah, well,
Probably.
I hope so. That's about the best thing that could happen to him at this point. Okay, you guys.
Good night, everybody.
Good night.
Night all.